Welcome to the TOPS Surgical Technique Training CD-ROM. TOPS is a total posterior spine system that is indicated for patients with degenerative spinal stenosis, facet arthrosis, and grade 1 spondylolisthesis. The purpose of this video is to introduce you to the TOPS instrumentation set and to provide you with key tips for preoperative planning and a smooth surgical procedure. Preoperative planning. The patient positioning is critical. An overly kyphotic position will lead to higher loads on the pedicle screws, while an overly lordotic position may limit the flexion motion. Therefore, you should position the patient in a neutral lordotic position, avoiding hyperlordosis or kyphosis. It is mandatory that there is ample access for the C-arm X-ray equipment. Surgical exposure. A posterior midline incision of approximately 10 to 14 centimeters in length should be performed to create the proper exposure for implantation of the TOPS system. Bone dissection. You should use your standard bone resection technique for decompression of the affected level. To verify optimal bone resection, use the TOPS template to verify that it fits properly between the vertebrae. Muscle dissection and retraction. As in all your procedures, it is important to avoid damage to surrounding soft tissues. Pedicle screw insertion. Accurate screw placement is important for the successful implantation of the TOPS system. Therefore, the use of K-wire to assist in pedicle screw placement is highly recommended. You should perform the insertion into the targeted vertebrae using your standard surgical technique under X-ray guidance, keeping in mind the following 4 points. The medial lateral insertion angle of the pedicle screw is important for the TOPS device to properly interface with the pedicle screw. To create the optimal medial lateral screw angle, select the trocar pendulum that corresponds to the treated vertebrae. Note that the goal is to maintain the pendulum marker within the ± 15 degree margin, so that the TOPS arms properly attach to each pedicle screw. If the pedicle screw insertion angle exceeds the compensation range of the polyaxial head, ± 20 degrees, the TOPS arm will not be properly attached to the pedicle screw. By using the K-wire, verify that you select the appropriately marked trocar pendulum for insertion. This instrument fits on any cylinder and can also be used with any pedicle screw path locating instrument. Another critical step is to choose the appropriate size pedicle screw. Optimal placement of the TOPS system requires that the pedicle screws be approximately 5 millimeters longer than what you would select if you were performing a fusion procedure. Also, the largest diameter screw that can be accepted by the anatomy of the pedicle should be used to maximize the pull-out strength of the screw. Place the pedicle screw at the tip of the screwdriver and lock it in place with the sleeve. Place the universal pendulum in the appropriately marked wing corresponding to the vertebrae being operated on. Insert the pedicle screw under X-ray guidance while maintaining the pendulum marker within the ± 15 degree margin. The pedicle screw saddle should be positioned such that the TOPS arm will not interfere with the transverse process. This step is repeated for all 4 pedicle screws, paying careful attention to align the screws on the same plane in the lateral fluoroscopic view. Mount the pedicle screw guide onto the screw finder. Locate the pedicle screw head with the finder. Slide the pedicle screw guide down until it can no longer be advanced. Remove the screw finder and verify that the screw guide is locked onto the pedicle screw head. Note that locking occurs only after the removal of the finder. You can mount or dismount the extenders during the operation. If you want to remove one or more of the screw guides, insert the screw finder into the pedicle screw guide until it stops. Slide the guide upward until it releases from the pedicle screw. Gauges are provided to determine the proper implant type, either normal or low profile, that will match the patient's anatomy. Select the appropriate gauge, regular or low profile, that will sit firmly within the saddle of the pedicle screw heads. In addition, the gauge serves as a tool to align the heads of the 4 pedicle screws on the same plane. Be sure to take the gauge that corresponds to the proper segment, for instance, L4 to L5, and the proper implant type, for instance, low profile. Verify proper up and down orientation. First, take the female half of the gauge and insert it into the pedicle screw heads. Insert 2 temporary set screws to lock the gauge in place. Insert the male half of the gauge into the pedicle screw heads. Insert 2 temporary set screws to lock the gauge in place. Again, verifying proper up and down orientation. Confirm that you have matched the proper gauge for the specific vertebrae. The 2 halves of the gauge will be aligned so that they become parallel from a side view when all 4 pedicle screws are seated to the appropriate depth. Markings on the gauge indicate the amount of depth adjustment that is needed to be made to one or more of the pedicle screws. A short line indicates the need to make a 1/2 turn, 180-degree adjustment, while a long line indicates the need to make a complete turn, 360-degree adjustment. To make an adjustment, the gauge and temporary set screws must be removed and the screwdriver applied. Note that because of the conical core of the pedicle screws, it is better to adjust the height by advancing the pedicle screws as opposed to backing them out. When both sides of the gauge are perfectly adjusted, such that the halves are parallel in both planes, this verifies that the pedicle screws are adjusted and that the top system will properly sit into the pedicle screw heads. Remove all 4 temporary set screws and the gauge. Open the top sterile packaging and remove the implant. Hold the implant in your hand for the filling process. To fill the tops, use a 5 cc syringe and a 27 gauge by 13 mm hypodermic needle. Inject 4 cc's of sterile saline into the device via the filling port. The next step is to attach the device to the TOPS holder, which is used for proper implantation of the TOPS system. Open the holder tongs by turning the knob on the end of the handle in a counterclockwise motion to prepare the instrument for grasping the TOPS device. Place the holder's tongs over the TOPS implant, verifying that the holder's up marking matches the TOPS up marking. Be sure that the 3 holder tong pins match the opposing TOPS socket pins. With a clockwise motion, close the holder tongs. The 2 arrows will be aligned, verifying that you have successfully completed this step. As an added precaution, verify that the down marking on the holder matches the down marking on the TOPS device, and that the socket pins fit properly into the TOPS sockets. Insert the TOPS into the pedicle screw heads, using the pedicle screw guides. Verify vertical positioning of the holder. After all 4 arms are placed in the saddles of the pedicle screws, insert 4 set screws through the pedicle screw guide and hand tighten them, using the screwdriver to secure the TOPS arms to the pedicle screws. Remove the 4 screw guides by inserting the screw finder before proceeding to the next step. Tighten the 4 set screws to 13 Newton meters using the torque wrench and the counter wrench. Remove the holder from the TOPS by turning the knob counterclockwise to open the tongs. Verify final positioning with an X-ray. Verify that all instrumentation has been removed from the surgical field prior to closing the incision using standard surgical technique. Refer to these 2 documents before implanting any total posterior spine system. Package insert for TOPS 172 CL SP. TOPS surgical technique 516 CL SP.